Well, good morning there. I haven't done one of these for quite a while. I think the last time I did one was in July. Yeah, it's been a long time. Mostly because time has gone by and I've had more duties and, the academic year started and we weren't seeing a lot of differences at the time and things kept on just getting worse and worse. So I said, okay, they're going to keep on getting worse. So let's just wait a little while and see how things go in a few months. So this is a table that includes case fatality. So that's a probability of dying if one is diagnosed with the coronavirus disease. The prevalence is the number of cases. Well, basically, it's the number of cases per 100,000 population. So I did everything per 100,000. The mortality rate is the deaths per 100,000 individuals, and I ordered them from 1 to, I think I have like 56 different countries now. Times have changed again, so some of the countries that I didn't have before, I should add in here. But honestly, I just want to compare this to what I had before. I did add Colombia in here because Colombia has a pretty high mortality rate and prevalence. So now the only problem with the prevalence statistic is that prevalence is the number of existing cases right now, and the problem with that is that we have to be able to account for those who have recovered, and we can't always trust people to report recovery. It's hard enough to get individuals to report the cases. I mean, governments report the cases. So like one case is Sweden, which I use because Sweden is an interesting case because they really never shut down completely, and they kind of had this theory of herd immunity, which, by the way, people completely misunderstand herd immunity, and it's like we live in a country or a world where people refuse to think or take time to think, and all they want to do is live off of some political agenda. Just study, read. Don't just look at Wikipedia. Well, Wikipedia can be good. Go further, go beyond it. Try to understand what's going on. I'll talk about herd immunity in a second. But anyway, the problem with Sweden was that they didn't have any data today on the number of recovered individuals. Now, where do I get my data from, you may ask? Well, you should go to Johns Hopkins, their COVID-19 map, because they seem to be the best because of the number of sources they use. So I do like that. So if you look at globally now, we have about 39 million cases. That's a lot of cases, and the deaths have been over 1 million deaths. So it's a lot. In the U.S., we have a lot of deaths, 218,602. Brazil, they have a lot of deaths too. So 153, 214. India, yeah, I know people will say it's because of Trump in the U.S. and the Trump supporter in Brazil. That's possible, absolutely possible. People tend to follow their leaders, and if their leaders try to downplay something, but they might not follow the appropriate behaviors. However, I think death from a diseases don't care about political parties. So one of the things about being a scientist, and in epidemiology or statistics, you're a scientist. You have to divest yourself from all politics and just report the data. One thing I know about pathogens want entry into a host. They don't care. They don't say, well, I'm going to enter that host because that host supports this candidate, or they're just interested in a host. And any one mistake we make in our behavior could allow us to become more vulnerable to infection. So if you're the best mask-wearing person in the world, but you just forget your mask one time, and you decide to go out somewhere and you start talking to another individual who's infected with the coronavirus, you'll get infected. Probably, if you have the right vulnerabilities. So there's no interest in political parties or any agenda here. And if you're going to be a good steward of science, you have to divest yourself from politics. Just focus on the facts. Obviously, junk in, junk out, we depend on having good data. And if people are tainted in some way in the presentation of data, what can we do about that as a scientist? We're only given the data that we are given. That's why I like Johns Hopkins, because it uses multiple sources of data. Multiple sources, so that we can confirm and assess and compare before the data are entered in this beautiful GIS map. So you can actually get some good data. So let's go to my charts here. So I rank these based on mortality rate. So that's deaths per 100,000 in this table. So we see Peru has 102. So this is 102 deaths per every 100,000 population. So if you take 100,000 individuals, you'll find 102 deaths. That's what this means. Belgium is still high. Spain, we in the United States are ranked number 8. I put Sweden here because Sweden, as I mentioned before, had this different approach based on herd immunity. Okay, let me talk about herd immunity. Herd immunity, we talk about this in public health, not because we don't want people to get vaccinated. We discuss it because we want people to get vaccinated. When we discuss herd immunity, we discuss it in relation to vaccination, not this other stuff that's going on. If we get enough individuals vaccinated, somewhere around 80%, every disease is different, but let's just take 80% as a good value. If we get about 80% of the population vaccinated, that'll protect the remaining 20%. That 20% are the individuals who cannot get vaccinated because of disease or other issues, or other vulnerabilities that could get exacerbated through vaccination, or maybe they also have an allergy or something, whatever it is. So that's what we talk. We don't discuss herd immunity as an alternative. Like, well, let's just let people get sick, and the ones who die will die, etc. We don't care. And that's not what we do. We focus on vaccination. So all this talk about, well, let's do herd immunity, that's really stupid. We'll get herd immunity once we get the vaccine. That's all we need to focus on. So when the decision was made, if this is true, and I've read where it's not necessarily the truth, but it's partially the truth, if that's what happened in Sweden and somebody said, let's just get your herd immunity and let's allow people to go about their business, that really sucks. Say, let's just sacrifice all the older people. Remember, when a person dies, say a person dies at 70 and that individual would have lived to 80, you could say something, wow, that person was 70, they only had 10 years left. Those 10 years may have been the most productive years of that individual's life. Just remember that, and that person could have done something amazing. A lot of people who have died had comorbid conditions, right, with other diseases, and some people have been saying, well, they actually probably died because of the comorbidity. I don't agree with that. They may have, but they may also have died because the coronavirus sped up or quickened or hastened the process associated with the comorbid condition. Just like there's a lot of stupidity out there. Please don't be stupid. Let's see. There's some places where we have very, very low mortality rates, and like, for instance, Taiwan, Vietnam. I remember there was a point in the pandemic when Vietnam had 0 deaths, and everybody was saying, wow, that's great. I think they have 35 deaths, and that's still pretty good for a large country like Vietnam. Again, many countries that you see at the lower end have very strict policies, and that's why they have so few deaths and such low number of cases. So they're doing a great job. I've also, in the past, and I'm not doing that today, have looked at why people die, or what we call case fatality. This is the probability of dying if one is infected. And I found that one of the main reasons is the proportion of hospital beds available in relation to the number of individuals, or the proportion of individuals above 65 in the country. That tells me that there's an interest in protecting older, vulnerable people. And a lot of that, unfortunately, occurs in wealthier countries. It's, what can you do? There's not enough, unfortunately, there's not enough money the way it's divvied out, or enough concern about people in lower income countries. It's very sad if you think about it. In terms of case fatality, you're most likely to die in Mexico. You have like a 10% chance, Italy, 9, Ecuador, UK. So here's Sweden. So Sweden is 5th on this list with about a 6% chance. We fall, where are we? Oh, down here, 24th. So we're doing okay in this case, so thankfully. There was a point where I thought it was going to be a lot worse than around 3%, but it's not bad. This is something we should be proud of, in that we have a better system for taking care. Even though we have horrible issues with healthcare, and particularly health disparities when it comes to minority versus non-minority groups, but overall this isn't bad compared to other countries, thankfully. So even Canada isn't doing as well as we are. So those are things to consider. This last chart is a chart that I started doing months ago, and I would do this every day. In the beginning of this pandemic, I've made these videos every day, and then I started slowing down. And again, I haven't done one since July. But this is prevalence. And again, as I mentioned earlier, you have to be cautious because prevalence relies, it's the number of existing cases. So that means we have to know how many people have died and how many people have recovered. And that's always difficult to compute because, again, we did rely on countries and their public health services and their data collectors to provide us with accurate data. But this is through, it says October 12th. So I did it. The x-axis here is a month. So this is just month from when I started. Just so there's a big gap here, but it's interesting to see who's worse. So right now, in terms of prevalence, we are just below, in the US, we're just below Spain in terms of, again, that's prevalence, existing cases. A lot of the data that you see in these maps isn't existing cases, it's ever cases. So when you look at this and you go, wow, the US has has ever had 8 million cases, right? So a lot of these people have recovered by now. So just gotta keep that in mind. So we don't have 8 million cases right now. But Sweden is up here. For a small country, that's pretty high. Again, this is per 100,000. So this is one way we can standardize, so we can make comparisons. US and then Italy, which was, obviously, if you look at the screen, Italy was a big problem early. And we've been climbing, although it looks like our slope has decreased slightly here. Spain's kind of on a rebound again, and I've noticed that in Spain, the government is instituting some harsher controls. Well, obviously, because we can't have this happen if we want to protect the vulnerable in particular, or until we get our vaccine. Which right now, just one last thing here, from reading and watching news from the CDC, from the FDA, we're probably going to have a vaccine, getting an emergency order to produce a vaccine somewhere, at the end of the year, early, maybe in January. Anything before that is probably still going to be investigational. I mean, there are people who are being vaccinated now, and those are people who are in the phase 3 of the clinical trials, these large-scale trials of about 30,000 individuals for each of the vaccines being tested. And then some countries like Russia, they have a vaccine. China has something that they're doing. So we don't know what's being done in all the countries, but we'll probably be starting the vaccination process in January, and who knows by what time we'll be done, because there's some of these vaccines require 2 doses, some are only 1 dose, and it's going to take a long time. We've got billions of people to vaccinate. In the US, we have over 300 million people to vaccinate. So there's a lot of people that need vaccinating. And then a lot of those people won't get vaccinated, sadly, because of fear or whatever. But you really should look at what the FDA is doing to ensure the safety of these vaccinations. They're not cutting any corners, even though things are moving rapidly. You could say, well, how could they not cut corners if they're moving rapidly? Well, think about the usual process. There's a lot of stuff that goes on in between the beginning to the end. People actually work on other projects as well. Now everybody's just devoted solely to this project. So it's going to move faster. It's like anything you do. If you have to write a paper for something, but you have 5 other duties, it's going to take you longer to write that paper than if you only have that paper to write. Last thing, get a flu shot vaccination. I got mine the other day. It'll help. And you don't want to get the flu and somebody thinks you have the coronavirus. That's going to suck. Have a good day, and if you're interested, you can contact me with any questions. Thank you, and have a wonderful day.